What I hear has been done before, and I hear it's a simple thing. And I hear it's quite difficult, and I hear almost everything.
Welcome to Ask the Experts South Texas. Each week, we'll feature experts to educate you in everything from health and wealth, home improvement, the law, and life. Call in and be a part of the conversation. 308-8867. And now the hosts of Ask the Experts South Texas, Dr. Nicole Davis and Dr. Don Bledsoe.
Good morning, San Antonio. It's a bright, beautiful day. If you're just getting up, we're happy to have you listening to our show. If you've been up for a while, I was up when you got up. So I am Dr. Davis, and with me is
Dr. Bledsoe.
And we're with Ask the Experts of South Texas. We have a really good show for you today. It's a fascinating topic that we're going to be talking about, orthopedic medicine and stem cell therapy. And Don's going to give you a brief background on our guest today.
Okay, so our guest today is Dr. Garcia. And you are a native of San Antonio, correct?
Yes, that's right.
Born and raised, never really left.
Well, I did a stint in Houston and then in Dallas, but...
Never left Texas.
Never left Texas. Yes, that's correct.
Good for you.
I'm happy.
It's warm in Texas.
Yes, it is.
So you have just recently completed your 10-year recertification in...
Yes.
Can you tell me how that last 10 years have been?
Good, great. Actually, the maturation of my practice. Recertification is the process that the Academy of Orthopedic Surgeons mandate that every 10 years you pass certain tests.
Good. That's great.
Yes, and so it just keeps your certification of competency on the line. So that was exciting. I had to study basic science again.
Go back to med school. So you specialize in arthroscopic surgery and total joint reconstruction.
I do, although I started and I did a fellowship in spine surgery. I did exclusively spine surgery for the first couple of years and found that a lot of the patients they came back to me for other things like knee pain, shoulder pain. So I never really lost what I had trained in, and so became a general orthopedist. And then as technology advanced, the field of joint replacements, the field of biologics, which is what we're talking about here today, has taken off. And so I've had a keen interest in this.
What made you want to go into medicine?
Well, I wasn't going to. My father was a physician. My oldest brother was a physician. The third was a dentist, and of course I was rebellious. There's no way
I'm not doing it.
So I was pre-architecture, and I really enjoyed the aspect of building things, taking things apart, but I found I could never put them back together very well. And just the mechanical aspect of working with my hands. And then I realized I was always good in biology. My best grades were really in the health sciences, and I would say a third of the way into college, I decided to move into pre-med, and it turned out well.
Good.
So, stem cell research, and I really want to cover this in this hour, has a very interesting history in the last 10 years, especially because there for a while certain parts of it had not been approved by the FDA, but there's this whole huge resurgence of efficacy trials and clinical trials where, yes, it is competent care and treatment for different types of disorders in the body. So with orthopedic medicine, how are you using stem cells?
Well, it encompasses so many things. If we go back and looking at my spine career, if we go back to some of the spine procedures that are done, for instance, a decompression, and then you fuse the spine for a degenerative condition or an instability, at that time of the procedure, we would take marrow cells, spin them down, and those are stem cells. So it aided the fusion, it helped the fusion, and that aspect of stem cells has been around for a long time. And as things have advanced, we're now looking at really the holy grail, if you will, of orthopedics.
The fountain of youth.
The fountain of youth is cartilage restoration, because once it starts the process of degradation and wearing, we really don't have anything that stops that. It's on a lifetime that continues to decrease. So a lot of the research has been for joint preservation, so that we, instead of doing that total knee replacement, because they are now bone on bone at the age of 65, we're pushing it to maybe 75. And so that's just a small aspect, but cartilage regeneration has been what has been most studied in orthopedics. To a lesser degree, but equally as important, is the augmentation of healing. So if somebody ruptures an Achilles tendon and you repair that, can we speed the process in half? Can we get this to heal well?
And so in hearing, in conjunction with ear, nose, and throat, when they go in to do the sinoplasties, they'll spray in a prednisone to help it quickly heal up, post-op. So in essence, this is along the same venue, but it's actually your stem cells that are helping the healing process, because they're actually producing those like cells that it's next to.
Absolutely. It's almost, yes, we are. We're spraying that in, or we're laying that into the field, whereas the prednisone is the most powerful anti-inflammatory.
But you want inflammation.
Absolutely. So we're spraying stem cells that actually cause an inflammation to start the process of healing. It really does jumpstart that process.
So you've worked on the spine, the hips, the knees, the ankles. At what point is it not viable to use that type of intervention? Again, if I'm with a group, and the San Antonio Orthopaedic Group, and we decided some time ago to sit and say, what are our parameters? We cannot just open it up and say we do stem cells for every little thing or anything. So somebody who is beyond 70 or 80 years of age, who has bone on bone, ethically it's not really a viable candidate. That person's not going to get any benefit. We're very cautious with pediatrics because they're still growing, and their risk for tumor production from stem cells is higher, as we've seen. So it's the two extremes that we're trying to stay away from. So it'd be the young person that was heavily involved in sports, coming into their 20s with some major sports injuries. That may be a perfect candidate. Somebody who has played football, tore a meniscus, has developed a little bit of arthritis, and you've got no real answer for this person until you have to wait till they become, at the age of 50, they become arthritic, and then you do a replacement. I mean, there's something in between with osteotomies, but that is maybe the perfect patient for this, where stem cells are being studied. And there's two ways, if I may, simply taking the stem cells and injecting them. So that's live treatment versus tissue building, where you can take the stem cells, grow them in the laboratory, put them on a scaffold, so that if there's a defect, like a meniscus that's gone, that scaffold is then placed into the body and it replicates. So of the what you've seen of the spine, the hip, the knee, and the ankle, which one takes quicker? In other words, is the spine more successful, or is it not relevant which area, or is it more the stage of degeneration? Definitely the stage of degeneration has something to do with this. I would say that the purposes are different. In the spine, for the fusion, because that's what you want, you really don't want anything else, it does seem to be fairly quick, within the matter of months. In the process of cartilage restoration, we're looking at typically about 4 months, 5 months before you see that result. So the studies that we have are somewhat immature, in that we only have 2-year follow-ups and 3-year follow-ups.
And that's where we need a lot more research. It's not going to be the immediate quick fix. It really does take some time. But we've seen changes.
Well, when we get back, we're going to take a quick break. When we get back, I want to talk about how you and where you get the stem cells from the patient and the process that they go under with you while they're under sedation.
Great.
And we'll be right back, and you're listening to Ask the Experts of South Texas.
I don't hear words they're saying, only the echo.
Do your loved ones say, "You're not listening"? Do they tell you the TV's too loud? Or do you have ringing in your ears or feel dizzy without explanation? Call Associates of Audiology. They are the experts at diagnosing and treating hearing loss and balance disorders for all ages. Call 210-334-0245 or see them at associatesofaudiology.com for a better quality of life. Don't let your ears keep you from hearing.
And we are back here listening to Ask the Experts of South Texas. I'm Dr. Davis, and with me is
Dr. Bledsoe.
And with us today is a doctor from San Antonio Orthopaedic Group, Dr. Garcia. If you want to get a hold of his group, 210-804-5400. They have 3 locations in San Antonio, right in the heart of the city, and on the edges too, so we'll get you wherever you're at. So we were talking about stem cell therapy, replacement joints, total replacements of knees and hips. So someone comes to you, they have arthritis, they're a good candidate for stem cell therapy or partial replacement with stem cell therapy. Walk us through the prep and what you look at before the procedure, during the procedure, and after. That's a big,
Sure,
bite.
I'll try to cover it in a logical way. I think, first of all, it starts with the patient. Many patients are educated well enough with the advent of internet and everything that's Google now. Mm-hmm. They'll come in and talk to me and say, what about this article? What about this? Am I a good candidate for stem cells, for instance? And we go through that process of having a discussion, what we could do to augment their surgical procedure or just stand alone, do the stem cells. So the discussion is many times brought on by the patient. But let's say we're simply going to do stem cells in somebody who has grade 2 arthritis, grade 4 being the worst. So they've done their cortisone injections, they've done the viscose supplementation, the hyaluronate sodium, the rooster comb injections, as they say, and they still have a lot of discomfort. So we'll sit down and talk about that. The harvesting of the stem cells, in my opinion, there's different kinds, but the most beneficial and the one that has the most benefit, pluripotential differentiation is the bone marrow. Mm-hmm. The bone marrow has hemopoietic cells, and it also has mesenchymal cells. The mesenchymal cells are the ones we want. We then take those cells from the bone marrow and then treat them, spin them down, put them into the knee. But it does require some anesthetic because locally and maybe some sedation, because we are taking them from the iliac
It's
crest.
only your bones, folks. But you're going in deep to the marrow.
Yes. And so we will typically do that in the process of, again, standalone or with other procedures.
And how long are they out for? What's the process?
It's an outpatient procedure. They go home the same day. There may be a little bit of discomfort at the harvest site, no discomfort where they're placed. Let's speak about a knee. If somebody has that arthritis and we do this type of treatment, we want them moving. We want those cells to fill in the entire aspect of the knee, and the only way they get there is by movement. So we may put them on what we call a CPM machine, a continuous passive motion machine, and it's one that we see with total joints where we place the knee and they continuously move the knee, and 6 to 8 hours a day. That way the stem cells get throughout the knee. And wait and see, and then maybe protected weight bearing, but not for long. And usually we start to see improvement because they have powerful anti-inflammatory properties. So the inflammation will go down ultimately 2 to 3 weeks, and then ultimately what we see, at least in the studies that we've seen and some that we've done, is that at 2 years they're able to preserve the cartilage and they don't have any further degradation. To say that we've grown cartilage is a little bit, we're not there. We have in scaffolds, but just injection to the knee we've been able to preserve. And that's why our institute is called the joint preservation. Is we're trying to preserve rather than progress with.
Keep what you got.
Yeah.
So you can avoid the artificial knee
Yes, that's
and
correct.
hips. So I was also read an article where another doctor did, they would do the stem cells, but they would also treat around the area red blood cells. Like they would also introduce, it was either a growth hormone or something
Yeah,
on top of
that
it.
typically is, the acronym is PRP.
PRP, that was it.
Platelet-rich plasma. So they seem to be additive or adjunctive, where the PRP lays down the bed for the stem cells. It causes a lot of inflammation. It has the growth factors. It has the beta growth factors and the insulin-like growth factors that sort of stimulate the bed, and the stem cells come in and start, they take off running, if you will. So yes, I think that's very much what we would do for a knee, very much what we would do for a shoulder, where we would, because they're out, the PRP is obtained from peripheral blood, so that's not a big deal. So while they're out under anesthesia, we would do exactly.
So it's important to note that you're using that patient's stem cells.
Yes.
And so there's not rejection rates. It's all
Absolutely.
you.
Absolutely. And you may lead to this in the discussion, but that is important because there are many products out there that are not your cells and that are being sold and maybe not regulated as well, that can cause some issues in terms of rejection, in terms of oncologic or cancer-producing issues. So if it's your cells, the rejection issue is gone. There's no rejection. And obviously it tends to work much better.
So back to the other products out there that aren't yours, they do that? Like you can actually go somewhere and they would inject you with somebody else's stem cells?
Yes, the amniotic fluid.
Amniotic.
So
the placenta.
What's that? Placental.
Placental.
Placental tissue, cord blood. Absolutely, those kinds of things are out there. Embryonic is really not done here. It's maybe in the UK or
Russia.
in Europe and other areas, but not
Russia.
not allowed here.
Not allowed,
Absolutely.
Russians.
So that's an important question to ask your surgeon.
Yes. Where are these
What are you
coming
putting
from?
in my body?
Yes, and what have you done to them? Because there are rules that indicate you cannot take tissue, modify it, and then inject it, because you have now modified that. There's huge risks, including cancer-forming risks.
So somebody, let's say somebody was injected with not their own stem cells, would they have to take the, I don't know what it's called, the drugs to keep them from rejecting them?
it, yeah.
No. Then you're really stopping the entire process.
Okay.
You just get those injections and see what happens. You probably will get a very strong inflammatory response or no response, because what you're injecting is probably dead. Those cells are dead.
They're just proteins.
Yes, as we talked about before the show.
So folks, that's your important question.
What are you putting in my
What
body?
are you putting in it, and is it mine?
Great question.
Ethically, there's been a lot of debate over stem cell research. It started with when they were taking that embryo with the nucleus, extracting it at day 5 because it was a universal cell.
Yes.
And they could put it anywhere in the body and it would match the DNA that it surrounded, right?
That's correct.
So that has since evolved, and that is a non-issue now.
It is a non-issue here.
Because they found ways to harvest stem cells that aren't ethically challenging to some people versus
What
others.
they will do is they will take, there's different ways, whether it is a fetus that did not mature, but that's not allowed here. The other way is to take those cells very early on and then not implant them but grow them in tissue cultures. And so you have labs that have lineages of tissue cultures that ultimately can be taken.
Don't they do harvesting too? Like if you have a baby, you can save that placenta?
Well, yes, absolutely. That's another process.
Put it on ice.
You put it on ice and see if you need
on
it.
the rocks. But you can save it. I mean, if your child down the line, who knows what's going to be in medicine 40 years from now?
And that's
Look
the
where we're at
thinking.
now.
You're absolutely right. That's the thinking, that if this child develops some sort of unusual disease, you have now their beginning cells, and you can stimulate them to fight that disease. And so this has a lot of crossover with things like cancer and multiple sclerosis and so forth.
Incurable
Absolutely.
degenerative diseases that we can now start exploring cures for.
Yes.
It's pretty exciting. I would have picked your field had I gone to med
It's
school.
changing, and it's really it has been very exciting. Unfortunately, we're still, if I may comment, in the aspect of where the coverage of this, the insurance aspect of it is saying this is investigational. We are not part of that coverage. And so a lot of these things are, unfortunately, really a cash pay thing.
So even though it's FDA approved, insurance still says it's experimental.
Well, they call it investigation.
Oh, okay.
Well, that's awfully convenient.
Yes.
Because we see in audiology, even things like with Medicaid, they'll only amplify or allow one hearing aid on a person, and which is crazy because we have two ears.
That's right.
You know, but the clinical trials and studies of only amplifying one ear means you create a lazy side, neurologically, receptively for sound, all of it. And so these people are coming in with balance disorders, being, extremely off balance. When they get into noise, they can't process speech and noise. And, how do you explain that to them that, well, they thought you just needed one? So it's so complicated in medicine to have to meander around all that.
Yeah, there's definitely a lot of rules and regulations that are beyond us practitioners. And I think that's where educating the public and ultimately the insurers may be able to be fruitful.
But I got to tell you, the cost, even though it's a chunk of money, most people spend their money on junk. If you added up the number of times they went to fast food all year, you could get your joint replaced and stem cells and to boot. I think it's just, people, they'll look at the price and go, whoa, that's way too much. Well, what did you spend on your clothing this year or activities and leisure? So
no doubt,
to me, it's not that high.
And if you look at what you're getting potentially, especially if you have
mobility
and already a little bit of arthritis, and they kind of see the writing on the wall. Oh yes, I'd find a way to get that extra $1,000 to say I want my knee fixed, and I think again that's educating the public, and I hope this is one of the ways we're doing it.
Right. So, will insurance pay for pre-op?
This is where
like MRIs and
yes, of course they'll pay for their pre-op evaluation, and this is where it's easier to get somebody to have stem cells done. If you are already doing an arthroscopy with an ACL, because we know they have a torn ACL, the insurance will cover the pre-op, they'll cover the ACL surgery. You already have them in the OR. And if you do the stem cells, then we take that insurance, but we will ask the patient. That's auxiliary. Yes, it's auxiliary, it's augmentary. We'll say, if for this, which is not covered, we can do the stem cells, and many accept. Unlike doing stem cells alone, now you're charging the hospital cost, the anesthesia cost. So it's sorry to say, but sometimes the best time and the best way to do stem cells is when you already have an injury and you have to fix that injury. And it's up to us to educate them to say, here are the results with stem cells. Would you consider this?
Okay.
And so,
Well, when we get back, we're going to talk more about insurance, the process of getting pre-qualified for the procedure, and we'll be right back.
Doctor, my eyes have seen the years and the slow parade of fears without crying. Now I want to understand. I have done all that I could to see the evil and the good without hiding. You must help me if you can. That's what the man said.
And we're back from break. You're listening to Ask the Expert South Texas with Dr. Davis and
Dr. Bledsoe.
And we're with Associates of Audiology. We are audiology nerds. We love helping people, not with their voice, because mine is bad today, but with their hearing and balance, don't we, Dawn?
We love helping people hear, yes.
So we are talking today with Dr. Garza of San Antonio Orthopaedic Group. You can get a hold of them at 210-804-5400, or as he says, the TSAOG. And the OG.
OG.
That's right. So I was in my yard last weekend, and I was lifting up something, and I heard a crack in my back, and then immediately I could not move. I was frozen there. I was yelling like a mad woman, help, with all of my family. It hurt so bad, and I couldn't do anything about it. I couldn't even walk, because if I lifted up one leg, it was just a shearing pain. Diagnosed with a slip disc. Hurrah, this has been a great week for me.
Yeah.
So
you look better today.
I feel better today, but medication's great.
Sure.
But this whole time we've been talking about stem cell and therapy, it really spiked my interest because the ER nurse that helped me and the doctor said, well, we've got to strengthen your core. That's going to be long term. And then that's all they could offer other than the prednisone. Yeah. So how would you, look, if I came into you and I said, I'm having back problems, I have a slip disc, does stem cells, do they help with that type of an injury?
They can. I wouldn't do that as the first line. I think ultimately you go through the basic treatment, which would be a short course of rest, typical anti-inflammatory medications, maybe even the prednisone. And then functional restoration, try to get back to doing some of the things that you're doing cautiously, whether it's through physical therapy or some self-treating exercises. We talked earlier about Pilates and yoga, how they can be very protective to get the core and then to stretch. And let's say the sciatica continues and you map out this disc and the pain is quite intense. An epidural injection in that nerve area, an epidural block, can put out the fire. It can really help out. So now you're at the second stage where the pain is calmed down, but you have these flare-ups of these of this back pain. And there's been some studies, and we were alluding to what about discs in the break, where they've taken subjects and they've injected stem cells into the nucleus pulposus, which is the center of the disc, and compared that not only through MRI imaging with patients who had degenerative discs and others that didn't, that received a placebo. So it was randomized, controlled, and then a year later they re-MRI'd them, they re-examined them, and those dark discs became white. They became hydrated, which is truly reversing the aging process of the disc. And their back pain, by scores, by the Oswestry scores and things that we use, were much better on those treated with stem cells than the placebo. So there's hope. We can't say this is the end-all, be-all, but absolutely looking these stem cells could be placed anywhere as long as they're done well. But in this case, you're actually seeing a regeneration of that.
Which is something they discovered in research. Stem cells can grow.
Yes.
They can also turn back the clock
Yeah, because they
on cells that are existing.
they de-differentiate into cells that are more, I would say primitive, but they're younger, and they convert into those cells that you want them to be. So that's one of the hallmarks of stem cells, is that they have the ability to not only replicate, but de-differentiate into the cells that they need to be, wherever you place them.
Chameleons.
I don't think so. So let's talk about these guys, sports fanatics that play all the sports, football, whatever.
Sure.
And then they grow up and they...
Your husband.
Yeah. Hi, honey. And so he has cervical disc compression with bone spurs and severe pain and, probably some numbness in there. He doesn't want to do surgery.
Right.
Is there an option for him with this?
You could look at stem cells, and I don't want to give a blanket statement, but sure. No. But let's say the disease is isolated to two discs predominantly, because most of the disease occurs at C5, 6, and 6, 7. That's where most of the motion is. Where safely placing 1 cc of stem cells into each of the discs and protecting him, making sure he doesn't go out and do something crazy.
Like play football?
Yes. Then he could probably see a regeneration of that disc and possibly even diminishing some of that pain. You have to be cautious to say that this works for everybody. But
absolutely.
Yes, we've seen that in the lumbar spine and to a lesser degree in the cervical spine, yes.
Okay, honey. Your next appointment is...
How do you manage bone spurs in the spine? That's calcium. That's like growth. That's
is,
bone deposits.
Yeah, it is. It's the bones. It's the body's attempt to bridge over to stop the motion.
Right.
So these osteophytes form when there's excessive movement or excessive trauma. If you stabilize the disc, or the disc becomes healthier, then they tend to, I'm going to use the word that I don't like, melt away. But they do not grow any further as long as you have healthy tissue around it. Sometimes you have to go in there and remove those spurs, especially if they're pressing on a nerve and they have some nerve dysfunction. And simply that's a little cleanup, if you will. Some people say a roto-root or whatever.
It's like getting your teeth cleaned.
Yes. So
what's your feeling on prednisone? Because when I went to the ER last weekend, the attending doctor said, "How many times have you had prednisone this year?" And I have asthma too. I've had it over 3 times, like injections and therapy. And she said, "You're at risk for osteoporosis."
Yes.
That scared me.
Yes, I think we see, as an example, we see significant risk of osteoporosis for somebody who's been on steroids for a long period of time. They can't get off the steroids because they have such bad asthma or COPD or other issues with whatever neurologic issues that they have to be on prednisone. For the female, osteoporosis is a big risk, but you also get other kinds of things like avascular necrosis of the hip where it dies, or the shoulder. For those people that need prednisone to breathe, you have no other choice.
Right.
But sports injuries where every time you get hurt, every Sunday
they're shooting you up with a
steroid, you can absolutely, or the knee, or just in general, you can absolutely see a great amount of degeneration around that joint. So just in moderation. You're safe. It sounds like what you're
saying. Okay. Well, the only thing that happened to me this week is I gained weight. Thank you very much. My pants don't fit. Okay, so going back to joint health, like preventative, because my mom takes, you know those commercials you see, glucosamine chondroitin?
Sure.
Like you just say it in all one go, glucosamine chondroitin. She said it saved her knees and she could actually get mobility back because it reintroduced fluid. Is that correct?
It is for her.
Yeah, it is.
And
I don't argue with my mama.
So if we look at that, and that's a great question, because that's something that she can do on her own. She doesn't have to go to a doctor to get this. And when you kind of empower yourself to say, I can do these things and get better. So there's a couple of big studies that looked at glucosamine, Motrin, and placebo, and double-blinded and so forth. And so the glucosamine chondroitin sulfate had about 40% bump in patients that got better, equal to the Motrin. And obviously, I think it's safer than Motrin because Motrin can cause the gastritis and all kinds of other kidney issues.
Cause inflammation of the gut. Now you got another inflammation
You have another
disease
problem,
to take care
yes,
of.
or problems with the kidneys because it's metabolized through the
Right.
kidneys. But the funny thing is that the placebo got 20%. So both of these, all of them have a placebo effect.
Oh, no.
Yes, don't tell that to your mom, though.
I won't.
Mom, don't listen.
But definitely, I would say with that preparation, it takes 2 months for it to get to the target tissue.
So you
For-
can't
Oh
just
my gosh.
start and
that's right.
stop.
That's right.
It's long term.
So you buy 2 months worth, and if at 2 months you respond, you're a responder. Keep taking it. And if 2 months nothing happens, you stop. 2 months.
And do you reckon? Well, they always say like the calcium supplements with the magnesium and da da da.
I think
How effective is that?
magnesium plays into more of the muscle cramps, tends to work. Calcium more for somebody who's osteoporotic or osteopenia, where their bones are a little bit brittle, and that's typically a female issue, postmenopausal. And then in addition to the vitamin D, calcium, and a lot of exercise.
So I've heard walking is healthier than those, heavy endurance exercises. What is that, CrossFit, where they're doing the cowbells and
I
all
love
of that?
CrossFit. I see so many people that are injured from CrossFit too. I'm not going to bash them.
Has it paid for retirement?
CrossFit.
I think it's crazy to say, okay, I have a female body and I'm supposed to do weightlifting and throw my back out with these cowbells.
And flip this and flip this tire up and down.
Right, yeah.
But that's the mentality.
I don't get it.
A lot of people will say, "Well, I'm going to get fit," and they go into this boot camp thing, and
They go from nothing to a lot and then a whole lot of something afterwards.
yes, that's
Then they're really sore.
Oh, my heavens. We'll come right back. We're going to take a quick break. We'll be talking more about your orthopedic health. Be right back.
Do your loved ones say, "You're not listening"? Do they tell you the TV's too loud? Or do you have ringing in your ears or feel dizzy without explanation? Call Associates of Audiology. They are the experts at diagnosing and treating hearing loss and balance disorders for all ages. Call 210-334-0245 or see them at associatesofaudiology.com for a better quality of life. Don't let your ears keep you from hearing.
Listen to what the flower.
And we are back from break with Dr. Garcia. I've been saying Garza all hour, and no one corrected me at this
forgive
table.
you. It's okay.
Slap me. Okay, she just slapped me. All right. So you can see Dr. Garcia at San Antonio Orthopaedic Group, 210-804-5400. And I do need a hearing aid. I think that's the problem. And maybe a new pair of eyes. Now, you told me about a research article on with stem cells and vision.
Well, I heard about this, and many times when I'm driving, I get my news through NPR, and there was a short article, a short discussion, which then I looked up, and it's one of the horrific things that non-structured blind use of stem cells can cause problems. So there was a study for macular degeneration where it leads to blindness, and the Japanese study was well done. They took very specific stem cells for that tissue and placed them there, and many of their patients were able to get their vision back. So some people figured, well, we can do that. They were ophthalmologists, and they did that in Florida and took general stem cells, put them into the eye, and those patients that were could see now became blind, and obviously they shut them down. So it was a very stark example of not all stem cells are alike or work just placing them. You have to be, it has to be done correctly. That we've also heard, and I think we were discussing before the show, about stem cells being injected and having cancers happen or growths happen, because a stem cell is like a cancer cell. It replicates itself fairly fast, but it has to be controlled by hormonal and neurologic stimuli to turn into the right cells.
Which is why you don't recommend it on teenagers
or
children?
Yeah, children. Yeah, absolutely not. It's because they are going through a growth phase, and you don't want to be messing with what's already growing or maturing, and that's very important.
How about with muscle tissue, like tendonitis? People that have tendonitis?
Sure. So I would say more the tendon, which is where a muscle attaches to bone, the Achilles tendon, rotator cuff tendons. There's so many of them, and that's also an exciting field for stem cell usage. We looked at the results for rotator cuff, Achilles tendonitis, lateral epicondylitis, and they've been very promising, where you could potentially speed the process to the point where they don't need surgery, and the time that is immobilized. Sometimes you have an Achilles tendonitis, you're 3 months in a boot. You can get rid of that with stem cells. I mean, you still protect them, but maybe a month. So there's some exciting and very promising studies for tendonitis, in addition to everything that we talked about. So whatever you want to fix that's tissue, it can be done. We didn't touch on spinal cord injuries, neural tissue. They're looking at that. That would be very promising as well.
So the areas that don't receive a lot of blood flow, like the fibrum, a lot of dancers will have that part rip or tear.
Yes.
My daughter's one of them.
Yes.
And it was, she doesn't dance anymore because of it. So, and they said, well, we can either resection it and attach it, or just do different activities for a little while. I said, we'll pick different activities for a little while.
Yes.
But she's at risk for arthritis.
Yeah. As much
it's a brutal sport.
It is a brutal sport. My daughter was dancing, and the injuries to the feet, the injuries to the
hips ankles, knees,
is tremendous. So there's no doubt. I think protective, and we try to prevent. But once it already happens, then how can we speed up the process? And you mentioned muscles and tendons, and I think the stem cells hold a lot of future in that. Absolutely.
So what about the post-op? So they go home, 2 to 4 weeks, they start feeling better. I read on your website that you guys have a physical therapy unit as well.
We do. We in conjunction, contiguous with our practice, so that if we send somebody to therapy, we can instruct the therapist that this is the nuances of this operation. It isn't just a rotator cuff repair or meniscectomy. And
it can be behavioral, like what you're doing in your day-to-day activity.
Yes. And that's where the therapists really are able to sit down with them and for an hour discuss, tell me about your home. Well, the biggest issue is I have to maneuver 10 flights of stairs. Well,
there we go.
You get to sleep downstairs now, whatever. But yes, absolutely, it's been extremely beneficial to have therapy on board, especially with these newer procedures, the stem cell injections, to say this is what we want. We don't want a lot of loading, but we want a lot of motion.
And how effective is chiropractic?
It can be.
with spinal injuries?
It can be. There's been shown that for the first 6 to 8 weeks, there's some benefit in terms of mobility and diminishing pain with adjustments or chiropractic manipulations. Beyond that, in the chronic pain, it doesn't help. But in the acute phase, same thing with acupuncture, by the way. So there's some benefit to some of these non-standard, maybe what we call non-traditional, but now they're becoming traditional.
So Dr. Garcia, I'm going to say it right. We're all going to laugh. So for the degenerative diseases where it's not just in one spot, is that not a good candidate? In other words, like rheumatoid. It's autoimmune in origin.
That's a good question. Not for that joint unless you turn off that gene marker that is causing all the joints to be affected. And so for you'd be chasing your tail. You treat one knee and you shut it down with stem cells, but then the other one. So that's more in the genetic aspect of it. And stem cells may play a role into that. A little bit beyond my field of what I do, but I can tell you in the next 10 years you're going to see some amazing things.
So speaking of that, where do you see the future of stem cells going?
Nothing but up, nothing but great. As long as we don't try to oversell and do the quick fix. As long as it's regulated well, you're going to see some amazing results in things like Alzheimer's and dementia, things like diabetes for insulin-resistant conditions, hopefully some of the neurologic conditions and for us simple people like orthopedists that aren't dealing with very complex things, joint preservation, being able to take somebody who probably needs a knee replacement at the age 50, and then we're expanding that to maybe age 70. Yeah, really exciting places.
Yeah.
Along with the complete joint replacement, because you do that as well. I don't want to just only talk about stem cell. A lot of our patients are quickly back up on their feet, and I can't believe that they're actually walking, that quickly with no pain, because I've seen them for years and they were in such bad shape. It's pretty effective.
It's very effective.
The total knee and hip replacement.
It's one of the most effective procedures, cost effective. Nowadays, it isn't how do you feel, cost effective. Are they able to go participate in community where they're, earning a job, earning a wage, and paying taxes? Compared to many other surgeries, it's really quite cost effective. And now with minimally invasive, less invasive, robotic.
I was going to ask you about that.
Yeah.
The computerized surgeries.
Not quite like the Da Vinci. I don't know if you've had a guest that talked about that, but
with the prostate and the kidneys.
Yes, extremely well, because you're dealing with a lot of nerve tissue in that area. But we have robotics, what we call makoplasty, and it's been exciting. But it's good to see somebody who could hardly walk, and within a matter of weeks, they're walking good. And they're walking straight, and they're in very little pain. The sad thing is, if I may, the studies indicate, well, some of them are overweight. You're going to have your knee replacement, so you can exercise right, and we talk about it, and you're going to lose weight.
The follow-through.
And the follow-through is, they're able to walk, but they're not doing...
something else is going to break.
Something else is going to happen. That's probably more of a harder habit to break. But as you have had guests with about nutrition, I'm sure.
And rotary cuff, I see a lot of guys that it's so painful.
It is a tough joint to treat because the shoulder has the most motion of any joint in the body. If you treat the knee, it's flexion extension. That's it. If you treat the rotator cuff, it's abduction, adduction, internal rotation, external rotation. So to get it right, if anybody that you know has had rotator cuff surgery, you immobilize them for 6 weeks before you start therapy, and then you start the therapy. The process is 3 to 6 months I've got a little bit of rotator cuff, and I'm not letting anybody operate on me.
What about stem cells? Would you do that?
I would. I would consider it. Yes, ma'am. I sure would.
You've got a big practice. You've got lots of
I
docs
can
you
see
work
if
with.
I can get some of the associates
That's right.
to inject me. Okay.
But you'd be like centrifuge that stem cell right.
Yes.
You'd be like, and
Yes.
to the anesthesiologist, don't knock me
You
out.
could be your own research paper.
I could. I would say success.
There we go.
Because, yeah.
Yeah.
Ultimately, our group has a research lab and research branch. We are collecting data. And that's the other thing is you really want to not just rely on other people's data, but get your own. And that's what this group is able to do.
That's awesome.
Yeah.
So 3 locations. You've got one right up the road.
Yeah, at the Concord, which is our central location, Jones Maltzberger, at the Concord, at Stone Oak, and then one at Westover Hills.
And your website address is?
TSAOG.com.
And people can get a hold of you at 210-804-5400. And anyone who's having chronic arthritis, problems with any of their joints, tendons,
The back.
torn ligaments, their back, give them a call. And then give us a call if you need help with your hearing or you just want to talk. We'll see you guys next week. Happy Easter. Good Friday's coming up.
Next week.
Yeah. And we'll see you guys next weekend. We wish everybody in San Antonio a good weekend. Thank you so much, Dr.
My pleasure.
Garcia,
Yes,
for being
my
on the
pleasure.
show.
Been lovely. Thank you.
Okay.
Doctor, my eyes have seen the years and the slow parade of fears without crying. Now I want to understand. I have done all that I could to see the evil and the good without hiding. You must help me if you can. Doctor, my eyes. Tell me what is wrong. Doctor, my eyes have seen the years and the slow parade of fears without crying. Now I want to understand. I have done all that I could to see the evil and the good without hiding. You must help me if you can. Doctor, my eyes.